Hello, everyone, and welcome back to another episode of Global Impact Podcast. I'm your host, Ali Mehdaoui, and today I want to start with a question that I think every single one of us needs to answer. When was the last time you went to the doctor when nothing was wrong? Think about that for a second. Most of us take our cars in for an oil change before the engine breaks down. Pretty sure you do. We change the batteries in our smoke detectors before there is a fire. We update our phones before they completely stop working. But when it comes to the most important thing that we own, our health, we often wait until something feels wrong and then we react. But what if we actually change that mindset? What if healthcare wasn't only about treating sickness? What if it was also about protecting health? Today, we're talking about something that could potentially change not only the quality of your life, but the way that you think about healthcare altogether. We're talking about prevention. We're going to explore why preventative care matters, why annual wellness visits shouldn't be ignored, how understanding your personal health risks can empower you, and why primary care is about so much more than showing up when you're sick. We're also talking about the real meaning of self-care, how wellness and membership programs may simplify access to preventative services. And finally, I'm going to challenge you to answer one very important question. How well are you actually taking care of yourself? We've got a lot to talk about, so let's go ahead and get started. Segment 1, prevention is better than treatment. You've probably heard that saying before. An ounce of prevention is worth a pound of cure. It's an old saying, but when you think about your health, the idea behind it is incredibly relevant because many of us have developed a reactive relationship with healthcare. Something hurts, call the doctor. Don't feel well, make an appointment. Symptoms aren't going away, now we start paying attention. But preventative healthcare asks us to think differently. Instead of only asking, how do we fix the problem? We also ask, what can we do to reduce the risk of the problem developing or catch it earlier? That's completely different than the conversation we're having now. Preventative care can include routine wellness visits, appropriate screenings, vaccinations, health assessments, laboratory testing when recommended, and conversations with healthcare professionals about your lifestyle and individual risk factors. And here's what I want everyone listening to understand. You don't have to become obsessed with your health. You don't have to wake up tomorrow and completely change your entire life. This isn't about living in fear or of getting sick. This is about being proactive. Maybe it's finally scheduling that appointment that you've been postponing. Maybe it's having your blood pressure checked. Maybe it's talking to a healthcare professional about your family history. Maybe it's improving your sleep. Maybe it's changing something small in your nutrition or physical activity. Prevention isn't one giant decision. It's a series of small, tiny decisions, and those small, tiny decisions can add up over time. So here's my first question for you today. Are you proactive about your health, or do you tend to wait, like the rest of us, until something feels wrong? I want you to think about that for a second. And if you're comfortable, answer in the comment, because sometimes simply recognizing our own habits is the very first step toward changing them. Segment 2, annual wellness matters. All right, let's talk about something that probably isn't at the top of anybody's list of exciting things to do this year. Your annual wellness visit. I know, nobody wakes up on a Monday morning and says, yes, this is the week that I get to go for my annual checkup. But here's the thing. Annual wellness visits aren't simply about looking for what's wrong. They are an opportunity to talk about what's right and what keeps it going that way. Think about everything that can change in 1 year. Your weight can change. Your blood pressure definitely can change, especially with the way we eat in this country. Your sleep patterns can change. Of course, remember that thing called stress? Yeah, that too. Your stress level can change. Your medications can change. Your lifestyle can change. Your family medical history can actually become more relevant as new information emerges. And sometimes changes happening inside our bodies aren't immediately obvious to us. That's one reason routine healthcare can be so important. So your healthcare provider can evaluate what's appropriate for you based on factors such as your age, history, symptoms, medications, and individual risk profile. An annual visit can also give you something incredibly valuable, a baseline. Because when healthcare professionals understand what is normal for you, they may be better positioned to recognize meaningful changes over a period of time. So if you're thinking, I feel fine, what should I do? Well, that's an actual part of the point. Healthcare shouldn't be about getting you back to healthy. It should also be about helping you stay healthy. So let me ask you this. When was the last time you had a wellness visit? You don't have to answer publicly, but answer it for yourself. If you had to think really hard to remember, it may be time to put that conversation back on your calendar. Your future self may actually thank you for it. Segment 3, health risk assessments can make a difference. Now, I want to talk about something that sounds a little clinical, a health risk assessment. But the concept is usually pretty simple. It's about understanding your personal health picture because we are all different. Your health risks aren't necessarily my health risks. Your family history is definitely not my family history. Your lifestyle isn't my lifestyle. And that's why personalized healthcare matters. A health risk assessment may consider different aspects of your health and lifestyle to help identify areas that may deserve additional attention or discussion with a qualified healthcare professional. Think about your family history, for example. If certain health conditions run in your family, that's information worth knowing. It doesn't mean you're automatically going to develop the same condition, but it may help inform conversations about appropriate screening, prevention, or lifestyle choices. And that is why knowledge can be so powerful. Not because knowledge gives us a crystal ball. It doesn't. But because information can help us ask better questions, and better questions helps us make more informed decisions. Here's something you can do today. Ask yourself, do I know my family's health history? Do I know my recent blood pressure? Do I know which routine screenings may be appropriate for my age and personal risk factors? Do I know what questions I should be asking my healthcare provider? You don't need to diagnose yourself. Please don't go online at 2:00 in the morning and convince yourself you have 17 different diseases. We've all been there. You start searching for a headache, and 5 minutes later, the internet has you planning your own funeral. That's not what we're talking about here. What we are talking about is having informed conversations and qualified healthcare professionals. Because understanding your health shouldn't create fear. It should help create a plan.
At Global Impact Wellness Group, we believe healthcare should be accessible, affordable, and compassionate. Welcome to Global Impact Wellness Group, a trusted provider of nationwide telehealth services. We are a licensed mental health organization dedicated to the care, rehabilitation, and well-being of children, adolescents, adults, and families. Our virtual care platform brings mental health counseling, urgent care, primary care, telepsychiatry, and even pet telemedicine directly to your home. All sessions are secure, confidential, and fully HIPAA compliant. Why choose us? Nationwide access, affordable monthly plans with no hidden fees, and a holistic approach to mental, physical, and emotional wellness for individuals, families, and even pets. Get the care you deserve, anywhere, anytime. Visit globalimpactwellness.com today.
Segment 4, primary care is more than sick visits. Let's talk about primary care. For many people, the relationship with primary care looks something like this. I'm sick, I need a doctor, I feel better, see you next time I'm sick. But primary care is much more than that. A strong primary care relationship can provide continuity. It means having healthcare professionals who can become familiar with your history and help you navigate your health over a period of time. Because your health isn't a collection of random disconnected appointments. It's a story, a timeline. And that story changes as you move through different stages of life. Your needs at 25 may be different from your needs at 45. And your needs at 45 may be different from your needs at 65. Primary care can play an important role in connecting those chapters. It can include conversations about preventative care, lifestyle, appropriate screenings, chronic condition management, medication management, mental and behavioral health concerns, and referrals to other healthcare professionals when it is appropriate. That's why I want us to change the way we think about primary care. Instead of asking, who do I call when I'm sick? Consider asking, who is helping me stay well? That is a much more powerful question. Segment 5, International Self-Care Day. What self-care really means. July 24th is International Self-Care Day. And I think we need to have conversations about what self-care actually means. Because somewhere along the way, self-care became associated with bubble baths, vacations, spa days, and candles. And listen, I'm having nothing against a good vacation. Absolutely not. Trust me. But real self-care goes much deeper than your influencer in your phone telling you about it right now. Sometimes self-care is relaxing. And sometimes self-care is doing something that you've been avoiding. Self-care can be scheduling your annual wellness visits. Self-care can be talking to a therapist. Self-care can be protecting your sleep. Self-care can be taking your prescribed medication as directed. Self-care can be setting a boundary. Self-care can be saying no. Self-care can be asking for help. And sometimes self-care means admitting, I am not okay right now. We need to stop treating self-care like something we earn after we've completely exhausted ourselves. You don't have to reach burnout before you deserve rest. You don't have to reach a crisis before you deserve support. And you don't have to wait until something is wrong before you start paying attention to yourself. So here's my question for you. What does real self-care look like in your life right now? Not on Instagram, not what looks good in a picture. Real self-care. What's one thing you could do this week that would genuinely support your physical, mental, or emotional well-being? Drop it in a comment. You might inspire somebody else to do the same. Segment 6. Did you know making preventative healthcare simpler? There's something worth exploring. For some people, one of the biggest barrier to staying proactive about their health isn't motivation. It's access. It's cost. It's convenience. It's understanding where to go and what services are available. Healthcare can feel complicated. And when something feels complicated, what do we tend to do? We put it off. I'll figure it out next week. I'll make the appointment later. I'll look into it when I have time. And suddenly, 6 months have gone by. Goodness, it's like my wife wrote this for me. That's why models designed to make healthcare access more straightforward can be worth exploring. Global Impact Wellness offers memberships options that may include access to preventative care, wellness labs, and ongoing support depending on the specific plan and individual needs. The goal is simple: help make healthcare easier to understand and easier to access, because staying healthy should not feel like solving a puzzle. You should be able to understand your options. You should be able to ask questions, and you should be able to find the level of support that's appropriate for you and your family. And if you've been wondering what's available, don't assume. Ask, explore your options, understand what's included, and find out whether a particular healthcare model makes sense for your needs. Segment 7, how well are you actually caring for yourself? It's an uncomfortable question for some of us because we're busy. We have responsibilities. We have people who depend on us. And sometimes we convince ourselves that taking care of everyone else means we're doing the right thing. But there's a tiny little problem. You are part of the family you're talking about. You are part of the family you're taking care of. Think about that. If you're constantly putting yourself last, eventually there's nothing left to give. So I want you to do a personal check-in. How am I sleeping? How is my stress level? How is my mental health? How is my physical health? Am I keeping up with the healthcare appointments that are appropriate for me? Am I moving my body even? Am I giving myself enough time to recover? Am I asking for help when I need it? You don't need perfect answers, by the way. You just need honest ones. Because if you simplify the answers to honesty, man, I'm telling you that you're going to see a huge difference in the way you operate. Because your health deserves your attention every day, not only when something feels wrong. So my final question, I guess, would be this. If you could make one change this week to better care for yourself, what would it be? Maybe it's scheduling an appointment. Maybe it's getting more sleep. Maybe it's taking a walk. Maybe it's finally just asking for help. Whatever it is, write it down, say it out loud, and put it in the comments. And then take the first step. And that brings us to the end of another episode of the Global Impact Podcast. So today, we covered a lot. We talked about why prevention can be one of the most valuable investments you can make in your health. We talked about the importance of annual wellness visits. We discussed understanding your individual health risks. We explored why primary care is about more than simply treating yourself when you're sick. We redefined what real self-care can actually look like. We talked about making healthcare easier to navigate. And finally, we asked perhaps the most important question of all: how well are you taking care of yourself? Here's what I want you to remember from today's conversation. You cannot control everything that happens with your health. None of us can, but you definitely can choose to pay attention. You can ask questions. You can have conversations with qualified healthcare professionals. You can learn about your personal risk factors. And you can probably take small, consistent steps forward, supporting your overall well-being. Your health journey doesn't begin when something goes wrong. It begins with what you choose to do today. If you're ready to learn more about preventative care, primary care, wellness services, mental and behavioral health support, telehealth, or available membership options, visit globalimpactwellness.com. Again, that is globalimpactwellness.com. Explore your options, learn about available services, and find out how the Global Impact Wellness team can support you and your family on your wellness journey. And before you go, do me a favor. If someone came to mind while you were listening to today's episode, send this episode to them. Maybe it's someone who has not been to the doctor in years. Maybe it's a caregiver who's been putting themselves last. Maybe it's a friend who keeps saying, I'll take care of it myself later. Share this conversation with them. Sometimes the reminder that we need comes from someone who cares enough to send it. I'm your host, Ali Mehdaoui. Thank you for joining me on the Global Impact Podcast. Remember, take care of your health before your health forces you to take care of it. Take care of yourself. Take care of each other. And together, let's continue making a global impact. I'll see you next time.
At Global Impact Wellness Group, we believe healthcare should be accessible, affordable, and compassionate. Welcome to Global Impact Wellness Group, a trusted provider of nationwide telehealth services. We are a licensed mental health organization dedicated to the care, rehabilitation, and well-being of children, adolescents, adults, and families. Our virtual